make the treatment of wounds extremely difficult. If you go for a systemic approach, you require 10 to 100 times the traditional dosing of systemic antibiotics. Topical treatments that have been developed to date are pretty limited. They are non-specific. They have poor penetration into the biofilm, quite a bit of toxicity, hematissions at times, making them very uncomfortable to patients. And in comparison, what we thought was we've already shown in our labs work previously that collagen-rich hydrogels are excellent at stimulating wound healing. So we thought we could impart some antimicrobial properties into these hydrogels and make them a much better topical treatment. So the methods of our study here are the design that we made was 4 cohorts of wild type mice and control group, where we just made 6 to 10 millimeter excisions on the rat's dorsum and censored them open with silicone rings and just let them heal on their own. This is just a measure of normal wound healing without any interventions. We had an infection-only cohort where we applied a Pseudomonas aeruginosa biofilm by this inoculation protocol that you can see diagrammed here below. And essentially this group only had transparent dressings applied every 2 days, just to see how the body would respond on its own in a wild type mouse to a biofilm challenge. We had a CHG only group. This is CHG without any significant alterations, just the traditional CHG that we've been using in our lab for wound healing purposes, but never for infection treatments before. And then we had our treatment group, our CHG with antibiotics, which was a ciprofloxacin preparation that we knew was from our in vitro work previously to be effective against Pseudomonas aeruginosa biofilms. So regarding our results in the testing of these cohorts, we had gross wound healing photography here. And as you can see, our CHG with antibiotics group here at the bottom, by day 14, you had quite a bit of wound healing and pretty much elimination of the biofilm. This is in comparison to our CHG only group and our infection only group. And in fact, the best comparison to the CHG with antibiotics was of the control group, which again is no infection. This is normal wound healing, and there's no distinction between the two groups by day 14 by gross wound photography. This is the same results that we saw when we quantified things using histology, essentially taking H&E sections of these wounds that we harvested from the mice dorsums and looking at them under a microscope and using basically the morphology of the tissue there to identify return of a basement layer. And we measured that return of basement layer and compared that to the known total wound length that we had for that mouse to begin with. And we made displayed that now as a percent, basically the percent healed over time, starting at day 0 and progressing to ultimately closure or 100% healed. So we see in the shaded areas also our 95% confidence interval per group. And what we see here is that basically by day 14 or day 10, after starting treatment, the CHG with antibiotics with ciprofloxacin, we see no significant difference between the control group, again, reflecting what we saw with our gross wound healing and our infection only and CHG only without any antibiotic properties lagged behind, and in fact didn't really heal until day 20, 30 after wound excision. And so to test if it's actually disrupting the biofilm itself or just promoting wound healing, we actually did a immunofluorescence study. And what we saw when we labeled the Pseudomonas aeruginosa is that in our infection-only group, we saw these essentially very large biofilm structures, as you can see here and here, that were basically embedded deep into the wound and did not allow for closure. In comparison, very grossly, as you can see here, there's not much more fluorescence, and the fluorescence that we do see isn't in a pattern that would be distinguished by a biofilm. In fact, it's kind of just in the apical layers that you can see here, kind of on the skin surface, as the mouse has essentially closed that wound by that day. And finally, we also sent some blood cultures, and we saw that none of our treatment group here had any culture from the blood at 14 days of growth. This is both aerobic and anaerobic conditions, whereas our early time points of infection did in fact grow Pseudomonas aeruginosa, as well as other microbes that we know to be embedded within biofilms. This can kind of see the opportunity there to become part of another biofilm. The lack of growth at later time points we think is more in line with the mouse either clearing it on its own or a mouse just being more resistant to the bacteremia, but not necessarily any issues there with regards to our treatment or lab submissions. So in conclusion, what we saw was collagen-rich hydrogel with ciprofloxacin was effective at eliminating biofilms in vivo. We see this both from our gross wound healing, our histology, and our antibody labeling. We saw that there was gross wound culture that was also supported by our wound length healing that was accelerated in comparison to not only our treatment, our control group, but also in comparison to our CHG only group. And we see that there's no systemic side effects. Our mice healed very nicely, and there is no kidney function that we see by basic renal and hepatic function markers during our submission of blood data by culture and by basic chemistries. Future directions for this work, we would like to prepare a similar preparation against MRSA. We'd also like to create multi-pathogen compositions that have different dilation parameters as well. And we would like to test these in vivo in a wound slough model that would better reflect the human antibiotic or human microbes present in biofilm-inflicted wounds. Thank you very much for your time.